Dear student, I am Dr. Prakash Mungli, a professor of biochemistry. So in this lecture, I will be going over disorders of branched chain amino acids. Our branched chain amino acids are valine, leucine, isoleucine, and let's see what kind of disorders will happen whenever there is a defect in the metabolism of valine, leucine, isoleucine. Let's get into the details. Now, a disease that is related with a defect in the metabolism of valine, leucine, isoleucine is maple syrup urine disease. The maple syrup urine disease, it is an autosomal recessive condition because of a defect in branched chain α-ketoacid dehydrogenase enzyme. Now, this branched chain alpha-ketoacid dehydrogenase complex enzyme, it has got E1, E2, E3 subunits, and similar enzymes which contains E1, E2, E3 subunits are pyruvate dehydrogenase complex, which is involved in the conversion of pyruvate into acetyl-CoA, and then we have a alpha-ketoglutarate dehydrogenase complex in the TCA cycle, that is converting alpha-ketoglutarate into succinyl-CoA, and here alpha-ketoacid dehydrogenase enzyme complex. All these complex enzymes, they contain E1, E2, E3 subunits, and they require 5 coenzymes, that is thiamine pyrophosphate, lipoic acid, riboflavin derivative FAD, niacin derivative NAD, and 𝗏𝐻𝐼𝐴 SH, CoAsh reduced form coming from pantothenic acid. Now, mutation in E1, E2, E3 subunits may cause maple syrup urine disease, especially with an enzyme that is alpha-ketoacid dehydrogenase complex. Now, if you look at mutation in individual subunits, like if E2 subunit mutation happens in this enzyme, it will give rise to thiamine responsive maple syrup urine disease. So, mutation in E3 subunit, it not only leads to elevation of branched chain alpha-ketoacids, it also leads to elevation of other 2 ketoacids that are catalyzed by a similar enzyme that I had told you earlier. So, let me, for easier understanding, let me write down all those 3 enzymes and what all the ketoacids that will be raised if there is a mutation in E3 subunit of alpha-ketoacid dehydrogenase enzyme complex. So, enzymes that I was mentioning is pyruvate dehydrogenase complex, which converts pyruvate into acetyl-CoA, and the second is alpha-ketoglutarate dehydrogenase complex that converts alpha-ketoglutarate into succinyl-CoA, and the branched chain alpha-ketoacid dehydrogenase complex converts branched chain alpha-ketoacids into their corresponding CoA forms. CoAs done by branched chain alpha-ketoacid dehydrogenase complex. So, there are 3 complex enzymes here. So, if there is a mutation in E3 subunit, why it will affect all the 3 enzymes other than alpha-ketoacid dehydrogenase? It is because the gene that is coding for E3 subunit, it is same for all 3 enzyme complexes, which I have mentioned in my pyruvate dehydrogenase complex lecture. So, E3 subunit gene is common for alpha-ketoacid dehydrogenase complex, branched chain alpha-ketoacid dehydrogenase complex, and alpha-keto. E3 gene is common for E3 subunit, that is required for branched chain alpha-ketoacid dehydrogenase complex, pyruvate dehydrogenase complex, and alpha-ketoglutarate dehydrogenase complex. So, when the E3 gene is mutated, all 3 enzymes are affected. That is why there will be elevation of alpha-ketoacids of branched chain amino acids, there is elevation of pyruvate, and also there is elevation of α-ketogluttarate. So that is why I have written here, there will be buildup of alpha-keto derivatives of all three branched chain amino acids and also other keto acids. So overall, in maple syrup urine disease, whether it is E1, E2 or E3 subunit is defective, there will be rise in elevation of all three branched chain amino acids keto acid derivatives. So the accumulation of leucine and its keto derivative leads to neurological symptoms. Remember that in a maple syrup urine disease, the neurological symptoms that you see is because of accumulation of leucine and its alpha-keto acid. Make sure you remember that, very important. And then accumulation of a keto derivative of isoleucine in the urine gives that maple syrup or a burnt sugar odor. This is the characteristic odor that you see in maple syrup urine disease. That is a maple syrup odor or a burnt sugar odor, and that is because of accumulation of branched chain alpha-keto acid derivative of isoleucine, and that is alpha-keto beta methyl valeryl CoA. Now, infants with this disease seems to be healthy at birth, but if left untreated, there will be severe brain damage leading to mental retardation and eventually there will be death. So symptoms of this condition includes poor feeding, vomiting, dehydration, lethargy, muscular hypotonia or hypertonia, seizures, ketoacidosis, coma, and eventually leading to neurological decline and may lead to death. So diagnosis is confirmed whenever there is a raised plasma levels and enhanced urinary excretion of branched chain amino acids and their keto acids. We'll have to look for that in the blood and in the urine. That's about maple syrup urine disease. Now let's move on to see isovaleric acidemia. Now the isovaleric acidemia is because of deficiency of isovaleryl CoA dehydrogenase, which is involved in the catabolism of leucine. So patients will show elevation of isovalerate, and children suffer from this disorder or they will show characteristic body odor. So they will show characteristic body odor, and frequency episodes of vomiting, acidosis, coma, and unusual body odor is more noticeable in isovaleric acidemia. And treatment involves restriction of leucine in the diet because it is the defect. It is because of defect in catabolism of leucine. Coming to propionic acidemia. Propionic acidemia is because of defect in the enzyme propionyl-CoA carboxylase, which will result in accumulation of propionic acid, and buildup of propionic acid will lead to seizures, lethargy, hypotonia, and also changes in the neuronal metabolism leading to encephalopathy. And the treatment here includes a protein restricted diet, a low protein diet, and L-carnitine supplementation and biotin supplementation, because biotin is a coenzyme for propionyl-CoA carboxylase enzyme. So it might improve the enzyme activity by supplementing biotin. Other disease that is associated with branched chain amino acid metabolism is conversion of propionyl-CoA to methylmalonyl-CoA, methylmalonyl-CoA conversion into succinyl-CoA. In that order, there is an enzyme called methylmalonyl-CoA mutase, and the defect or mutation in a gene, that is MUT gene, it is the one that causes around 60% of methylmalonic aciduria. So since the propionyl-CoA is the product of catabolism of amino acids, valine, isoleucine, threonine, methionine, and oxidation of odd chain fatty acids, branched chain fatty acids, bile acid synthesis, that is what we have remembered so many times. I have mentioned about it. Bob needs vitamin M is the mnemonic to know the sources of propionyl-CoA. Propionyl-CoA is converted into methylmalonyl-CoA, and methylmalonyl-CoA is converted to succinyl-CoA. And this conversion of methylmalonyl-CoA into succinyl-CoA is the one that is done by methylmalonyl-CoA mutase, and that is deficient. Now, that leads to elevation of methylmalonyl-CoA, which eventually leads to elevation of methylmalonic acid, and that can appear in the urine, leading to methylmalonic aciduria. So, age of onset of the disease in methylmalonic aciduria, it is 1 month to 1 year. Patient will show vomiting, dehydration, lethargy, seizures, recurrent infections, and progressive encephalopathy. Blood levels of ammonia, glycine, methylmalonic acid elevated. Urinary levels of methylmalonic acid, methyl citrate, propionic acid, 3-hydroxypropionate levels so elevated. More importantly, look for elevation of methylmalonic acid in the blood and urine. Diagnosis: enzyme determination in the cultured fibroblasts. Treatment involves protein restricted diet, cobalamin, L-carnitine supplementation, liver transplantation alone or in conjunction with kidney transplantation has been attempted in treatment of methylmalonic aciduria. So, these are the disorders associated with branched chain amino acids. So, we have seen maple syrup urine disease, that is because of deficiency of branched chain α-ketoacid dehydrogenase enzyme. Isovaleric acidemia because of deficiency in Isovaleric-CoA dehydrogenase involved in leucine catabolism. Then we have seen propionic acidemia because of deficiency of propionyl-CoA carboxylase, and then we have seen methylmalonic acidemia or aciduria because of deficiency of methylmalonyl-CoA mutase. So, that's all about disorders of branched chain amino acids. Thank you.